Hi everyone, this is John Mitchell, the Associate Director of IT for the 4 Humber CCGs, and today I'd like to introduce you to Simon. This is Simon, who is a fit and active well man, doing what he enjoyed doing, on an expedition, seeing new sights and new activities. Like most of us, Simon's life was centred around work and family and leisure, with just a small amount of his time dedicated to his health through his GP and rheumatologist. Unfortunately, on the 30th of August 2014, Simon's life was changed forever, where he had a serious accident. He's left with 4 metal rods in his neck, 25 screws, he required 6 months on the ventilator, and he's now a tetraplegic. As I'm sure you can imagine, Simon's life is now much more complicated. Whilst his family, friends and work are still central to his life, around the outside his care navigation is much more complex than it ever was before. And with this brings a lot of challenges. A lot of people make assumptions about Simon now, from not understanding his logistical requirements to talking about him in front of him to somebody else without asking him questions. And this is down to sometimes poor communication or just a lack of understanding of requirements. Simon and his family are IT literate, and clearly there are solutions here based around digital technology which could be exploited, from having access through to his care records where required to create practitioner empowerment, and so that Simon and his family don't have to retell the current situation about his health and his care to multiple practitioners on multiple visits, to a patient health record so Simon controls who can see his record and when, to updating medication records, which is really important so that all those involved with his care know exactly what medication should be on. But also around additional methods of communication, for example, video or audio conferences, so that Simon can control discussions about him virtually, bringing the right care practitioners together. Just by even creating a more rounded understanding of the specialist technology that Simon uses would create significant benefit, because at the moment it's very difficult to get joined up understanding of what he's capable of doing. Simon still wishes to point out that life for him is happy, although there are challenges which he needs to face which can be addressed by the use of technology and digital solutions. That's why we're here today. Thank you, everybody.